Hi, I'm Dr. Siddharth Vinod Mehta. I'm an ophthalmologist, cataract and a refractive surgeon working at Mehta Eye Clinic, Ghatkopar. Cataract, in simple words, there is a lens inside the eye which has now become cloudy, and that is affecting your vision. And only treatment for a cataract is you need to remove that lens and replace it with a new and artificial lens. Choosing the right lens is very important because not only it would affect your quality of vision but also your lifestyle. The first type of lens is called as a monofocal lens. It will give you a good distant vision so that you don't really have to wear glasses for that. But for near and for fine reading, you need a reading glasses. This is a very safe and a reliable option. The second type of lens is called as a multifocal lens, or nowadays we call it as a trifocal lens. As the word says trifocal, there are three focuses in this lens. It will take care of your far distance, it will take care of your computer distance, and it will also take care of your reading on near distance. So you don't really have to be dependent on your glasses, but there are times where very fine prints you might need an add-on glasses. The third category of lenses are called as the extended depth of focus lenses, or we call it EDOF lenses. Now here there is a much better range of vision, and again you get a much better distance as well as intermediate and near, but the problems which were seen in trifocals of glare and halos are much less. Nowadays, cataract removal has become very advanced. Earlier it was you used to take a nice big incision, you used to remove the whole lens in one go. But today, Phacoemulsification and more advanced as now the micro incision cataract surgery has become very advanced. Here the incision size is very small, the laser goes in, breaks the cataract into multiple pieces and you remove them out. This has become a go-to procedure for removing the cataract. The bigger advances that has happened is the robotic procedure or the femtosecond laser cataract surgery, or also called as FLACS procedure. The laser does the all critical steps of the cataract removal, makes an opening in the eye, makes an opening on the lens, breaks the cataract into multiple pieces. So once these things are done, now the removal of the cataract becomes much more easier and safer. FLACS surgery today is definitely a more safer option and highly advanced procedure for removing your cataract.